Hello and welcome. Today we are bringing Professor Salim Surani back to our channel. Dr. Surani, thank you for being here.
Glad to be here.
Dr. Surani has been to our channel multiple times, and we have recorded him for COVID-19 initial treatments and updates and so on and so forth. He has given multiple appearances on the TV shows as well. Today we are bringing him and asking, as you know, during this time when we are recording the video, the the match results are due. It'll be coming out next week. But the value of interviewing and interview process is very important. Surani has been a program director and he's been a mentor to many people. So we'd like to talk to him about it, that if he can share with us do's and don'ts during interview process, or what's his general take as a program director, as a leader, what he likes to see in candidates who do well on interview compared to who don't do that much well. So Professor Surani, please go ahead and tell us what would be some do's and don'ts from your standpoint.
So Dr. Keshav, thanks for having me over here. I think it's a very, very important thing. Everyone prepare for being a resident or being a fellow all their life. So you start our journey, when you're in high school, you want to make sure you get a good grades, you go to college, from college, you go to the medical school, then you try to excel. And now the main thing is how you can get to the best place where you like to be. And again, just like when you go to the exam, you prepare for the exam, you need to know what is going to be in the exam, what thing can be asked, how you're going to address. I think if you go to the interview unprepared or you apply to a place unprepared, the risk of not succeeding is very high. On the other hand, the preparation is a recipe for success. So first of all, you have to be clear in yourself what you really want to do. Because if you're not clear and you have applied to pediatric residency, internal medicine residency, the surgical residency, and psychiatry residency, then if you're going to have your application one thing fits all, it doesn't. Even if you are going to apply at one residency specific, and you're going to apply it at different places. So for example, if it is a community hospital, it's an academic research basic sciences institution, or it's an academic clinical institution, then your applications has to be tailored according to that. I know it is a lot of work, but that work is going to get you where you want to be. If you're trying to go and your applications and your statement says that you're interested in the rat diaphragmatic functions, or you're interested in the basic sciences research, and you're all the things you're lining up, which is geared toward your interest and passion, and your work experience is towards the bench research and a basic science research, and you're applying to a community hospital who does not even have any clinical research going on, and you try to sell that, oh, I'm that good in basic science research, that's where you're going to lose them right in the application. So the first thing is you have to apply is make sure that your application process is very consistent with where you're applying. So do some little background check. Nowadays, it's very easy. Everything is online. Everything is in the research. Look into who their faculties are, what the faculty interest is, what the PD interest is, what the division research interest is, or if there is any clinical basis they're interested in, and see if you fit right. And I can guarantee that we all do so much thing in our life that we have been trained to fit into a lot of different boxes. So we are like a kind of a joker card, which can be a match for any of these card deck. So the main thing is that you need to have a good preparation. You need to know where you want to go. You need to know what your program you're applying and what they're looking for, and if you are the right fit. And if you are the right fit, then you have to sell that, because if your program is looking for clinical, you're a very good clinicians, you're applying an internal medicine program, and what you have talked in all your statement of purpose is some research which you have done it in the surgical area or psychiatry area, that's not going to fly. So all your cards have to be very consistent. What your CV is going to be lined up in such a way that it is going to reflect your interests. Your statement of purpose is going to be in the reflection, and then your the letter of recommendation, the people you're asking has to be in line with that. In other words, you're applying in a medicine program and your person who is writing is pediatrician. That may not go that well. But on the other hand, if you're applying in pediatric residency and you have letters from a lot of the internal medicine folks and none from the pediatrics, that cannot go well. So you have to find and make sure that if you're applying to certain specialty, you have something to back it up. So I think that was not one of the main topic for the talk. Now, fast forward, the reason I'm bringing this in is because let's say if you have especially like fellowship, if you have 4 fellowship slots and you have 400 applications, yes, the score is number 1, which most of the programs set up this score that above this score, we can look at the folder. Below this, we don't look at the folder. So the score does matter. Once you have the score, let's say, out of 400, you have filtered out about 80 or 90. And out of those, you are going to, if you have 4 seats, you're going to apply 20 people. How you're going to do that? That's where your CV comes in, how you've looked into the CV. And CV, make an effort to make sure that the CV is done right, because that's a reflection of who you are. If you're not going to tell your story right based on the CV, I think there's a big challenge, because if you have to have an 80 application review, guess what? Initially, we are looking at the paper. Out of 80, we have to weed out 75% more of the people. And that is going to be done based on, because everyone has a significant score above the threshold which you want. So that's where your CV is going to reflect. Then what is in the CV, how you market, what things you have done, what paper and publication. Then your statement is going to align that, are you going to be a right fit? And are you going to be the person who what you're saying in your CV? And then your letter of recommendation have to match. So once you get that into it, then once you make into the first, the 25% of the people who are going to be in call for the interview, that's where it starts. The number one thing on the interview starts is even before you have the interview process. That's where your communication, what you're going to have with the program coordinator or secretary. Believe me or not, they have a lot of influence. They can be as flexible they want to be, and they can be as rigid as they want. So for example, there are several dates. If you're very nice to them, you're very courteous and very cordial to them, they can be very flexible in your travel arrangement, your accommodation, adjustments of the dates. And if you're not too nice with them and you're arrogant, you lose them right there, and they would not be flexible. And if you can't make that day, they will say sorry, and the chief is going to move to the next. And the program director or the interviewing panel may not know that. So that's your first interaction with the program. And you got to realize that even if you come to that program, you want to be nice to that person, because you're going to be dealing with that coordinator a lot during your terms. But once you are coming to the residency, make sure before even you are starting to interview, make sure who is going to interview you. You can always ask the program coordinator, and that's where your interaction with them comes in. They may like you, they may not like you, and that can be reflected and passed on to the residents and the faculty. So make sure that you get all the information of the interview process, who is going to interview, who is in the panel, who are the residents who are going to take you out, who are the resident who's going to show you. Do a good search about them. So be familiar with who you're going. And it's just like, if you're going in for any match, if you're going in your own field, you feel very comfortable. Obviously, you're not going in your own home, but you want to make sure you have enough information that when you walk into this place, you have virtually every idea of who is going to be like, what is their interest, what is their behaving, what is the current activity going on, is this faculty, what is his interest area, where he has done. And believe me or not, a lot of the times when you know about the faculty, you can always create the connection. For example, we have a lot of faculty from Sloan Kettering, and and a resident coming in, and if they know that this faculty who's interviewing, they have a connection, and they can say that, hey, Dr. So-and-so tells so many good things about you. And that faculty gets connection with their program where they came in, right on the thing, and their tone changes right there. So make sure that do the good research about them, make sure you're punctual on time, make sure you're properly dressed, make sure you're to yourself, and answer the question which is asked. And if you have aligned your statement of purpose, your CV, and your letter of recommendation in line with everything what you're asking and saying, they will ask you that, why you are choosing this program. And you have to be very passionate and honest. The clinicians and program directors are the music directors. So if you think you're a good musician or a singer, and you have been seeing again and again in the program, you play your two notes, they can judge you right there. You're a good musician or not. So you can't fake for what you're not. So you have to be very honest. You have to be very honest with your strength, and you have to be honest with your limitation. You don't have to show all your limitations, but you need to be aware that based on the CV, for example, someone has a score on the part 2 out of the world, but in part 1 they have not done that good. Maybe there is some good reason. So you need to show that, okay, these were my limitation. If you look at my medical school transcript, my high school transcript, my things before, that was a time maybe you had some health challenges. And I can tell you, I was interviewing one of the resident or something. I was kind of surprised why happened. And as a program director, I can know that something happened in that point where there was a big dip. So you were going good, there was a dip, and then it was up. So we know that that was not you. And it's still, we know that that was not you. We'd like to know. And, that person had been diagnosed with the cancer, or in one case, the family member was ill. So try to connect, be honest, know your limitation. You're not going to be the one of the most perfect candidate, because nobody is perfect. As long as you know your strength, you know your limitation, and you're honest, you're passionate. One is the thing is that, which always makes me smile. We all are passionate about what we want to do. We want to be a good doctor. We want to serve. So the resident comes in and, for first 5-10 minutes, he just keeps on telling me like, he's doing this for service of humanities and everything. And for 8-10 minutes it's going on. And if I'm looking at his CV, there was nothing humanitarian he has done in his career. And I just smile and I say, cut it short. You just tell me why exactly you are here. So I think, they can see right through that. So don't try to push a thing which you are not. You can make sure that they know what you are, what you have done, but don't try to push some other person who you're not, because they will be judged right through that.
Yeah, it's very, very important. I think several points you provided, saying this doesn't start at the time of interview, starts way before then. Preparing your application, pre-application process, and then how you approach each step of interview as well, and during at the time as well. So from your experience, if Dr. Surani, briefly you want to mention what are the big don'ts, like some, maybe 2 or 3 points, like you don't want a candidate to do these things during the interview process when they're sitting with a panel or they're sitting with you.
So a couple of things. One of the thing is that someone tries to sell what they are not. We can see right through that. That's something which you don't want to do that. And one of the thing is you got to realize that you need to make sure you are prepared for the interview, because guess what? Whoever is sitting in the interview panel, they all know about you, because they all have looked at your CV. They all have looked at your recommendation. They have all looked at all your transcripts. So they know which area you are strong, which area you're weak. So you need to make sure that you know what is in your CV and everything. If you don't know yourself and they know it, that's a bad thing. So you don't want to do. Second thing is, you have to be punctual. Nobody likes to be late, and nobody likes to be excuses and excuses. And I think, if you are late for the interview in person or through the Zoom, that's a bad omen. So people can see right through that. The third thing is that, which is very challenging, is that you need to be looking very attentive and interested in the interview. I've seen sometimes, somebody interviewing in the Zoom, and when you ask the question, they're always looking at it and talking. And you can imagine that if I'm looking over here and I'm going like this, yeah, that's a great program always. And I know that some people have a tendency to look here or there. You need to look right on their face, and whether it's in person or either in Zoom, you cannot. And I've seen sometimes, somebody do like this, and they're trying to reading. We know that means, we do a lot of those things. So I think you need to be interested. And sometimes when a lot of the time I've seen very commonly, uh, you know, uh, sometimes they ask the question, we always ask them, do you want to know anything about our program? And they say, oh, can you tell about some research interests? And, we start telling, and we can see from the body language that they're not really interested. So you can imagine that any of the speaking and engagement you do, the body language plays a 90+% role. The content plays 5-6%, and what you're saying is very minimal. So your people are watching you. They're watching your body language. So biggest don't is that you don't want to look disinterested, or you don't want to look like, oh yeah, I know it all. And anytime, I think, we have also seen some, and I'll give you a classic example, that anytime when I look through the applications, first of all, let's say out of 80, I want to call 20 people, I look at 20, and I don't tell the panel what my ranking in my mind is. And I try to give them 1 to 20 in my mind. And these are my pick. And then that comes the interview. And I can tell you the first thing we like in the program, I have usually asked my program faculties who are interviewing. And let's say we interview, after each interview, we sit down, we talk about it. And then after the end, we talk about it. First question I ask him, which one you think we shouldn't take it? That's important because
You said shouldn't take it.
yeah, which one, no matter what the grades are, what the scores on the exams, whether they have done 100 publications or not, whether they have done, because we look at the compatibility of our residents and faculty with whoever we are getting. And if you come across in the interview that you are totally not compatible with what we feel like, you're very arrogant, you come out like know-it-all tendency or something which we feel that we would not fit. So the first question I always ask is which one we don't want. So in other words, let's say, we want to rank 15 people. And if they tell me that there are 6 or 7 people that don't want it, that person is not going to go to match. Even if you have to fill less people in the match and we can go to the post-match or, we would not take that. So you need to make sure that you do not come out as arrogant. You do not come out as somebody who cannot amiably mix with the people. You do not want to come out someone who is very rigid and non-flexible. And I'll give you a classic example. There was one person in my list was number 1. When I pre-scrubbed the list based on the paper, the publication, the thing. And when we interviewed that person, and towards the end, unanimously, everyone felt that we do not want that person. She was just starting and she was acting that she was a professor above all the professors. That just killed it, because yes, her CV was good, but not to that extent that, you can. And even if your CV is that good, if you feel that way and that attitude in the interview, how can you get in? Because you are going to be dealing with everyone for 3 years. So that one was not even listed. So the interview plays an important part. It can make or break you. And there was one person who was 12th on the list that made it to top 3. So in other words, if you have a 4 slot, if he decided to come to our program, he definitely would have got it. So these are some don'ts. You don't want to look disinterested. You don't want to come out arrogant. You don't want to come out someone who would not have a flexibility. And you got to realize in interview, we are limited. We cannot differentiate anyone on the base of race and age and gender or anything. We cannot ask whether you have a kids or any of those limitations, because that one is not. It is based just on you and your performance, not on anything else. So based on that, the thing is the attitude is the key thing. If you have a good, positive attitude, amiable personality, you're on time, you're dressed up nice, you're attentive, you're totally focused on what you've been asked or response, and be clear and precise on your response. Don't try to give the responses just like, and if you don't know the answer, just be honest with
Say
that.
so.
We never ask the academic questions in our program, but I know that there are some program who will ask, just want to see what is your rationale and how you do. They will say like, how do you manage DKA? And in between, if they ask a question, if you don't know the answer, be honest with them. Don't try to dodge the questions or answers. That just goes very negative.
Absolutely. No, very important message. And thank you for sharing your experience while being on interview panels. I think, as you said rightly, having a right attitude, being humble about it, and being honest about and being transparent about your skills goes a long way. Thank you so much for being with us today, Dr. Surani. We'll bring you back. And those who are watching it for the first time, please like, write in comment section, subscribe to our channel so you'll get an alert when we upload these videos. We almost upload videos every other week and 2 to 3 weeks. And then there's a huge list of videos already on that. We have more than 60 videos on channel now. Thank you once again, Dr. Surani.
You're welcome. Glad to be here.